Coming to the success rate of IVF. The success rate of IVF varies. It depends upon number of factors. It depends upon the age of the couple. It depends upon the medical conditions of the couple and the cause of the infertility. Besides, the lifestyle factors of the couple also determines the IVF success rate. Taking example, the age. In less than 35 years of age, the success rate that has been reported by SART organization is 41 to 43%. But as the age advances, the success rate decreases. Above 40 years, the success rate decreases to 13 to 18%. As I discussed that the lifestyle of the patient, of the female and the male partner also determines success rate. So there are some lifestyle tips that will help you to improve the success rate. First of all, coming to the diet. Healthy and nutritious and balanced diet is very important. What does that diet include? It includes taking lean proteins like poultry, fish, taking fresh fruits, vegetables, eating avocados. The oil which you use is olive oil or sunflower oil. Besides, including legumes like beans in the diet, all these helps in improving the success rate. Avoiding the red meat, sugar content, processed food, highly refined food is also important. And cutting out the salt intake, adding herbs or spices for your food will also help in improving the success rate. Now, apart from diet, taking plenty of oral fluids is also important. And that should be water, not carbonated drinks or any other thing like caffeine or tea. Besides that, sleep, taking adequate rest is also very important. 7 to 8 hours of sleep in day is night sleep, and that too, it has been seen the hormone melatonin has been related for the reproduction and sleep. It releases in the night. So taking proper night sleep is also very important. Stress. Avoiding stress is very important. Although it's very easy to say, but do yoga, do meditation, that is important to keep yourself stress-free. Mild exercise or yoga or meditation should also be done. After IVF procedure, it's not necessary to take complete bed rest. Although you can cut off your running, but with mild exercise you can continue. Now, very important, there are chemicals that can affect your hormones, your reproductive potential. So avoiding those chemicals that contains phthalates, that contain parabens, that contains formaldehyde. These are difficult terms, but these are very common in your day-to-day activities. So avoiding nail polishes, avoiding cosmetics that contain these things, the soaps that contain these things, the furniture, clothing that might be having these harmful chemicals. These needs to be avoided. Now, if you are planning for IVF, consult your doctor and tell about the medication you are taking. If you are on any medication, tell each and every medication, whether you are taking over-the-counter drugs like ibuprofen or aspirin, or you are on a permanent drug. It can be any anti-epileptic, it can be steroids for asthma, or any other drugs that you may be taking, because it is important. That may affect the drugs, the injectables that are used during IVF. So inform your doctor about medication. Stop smoking. This is very harmful and it affects our success rate a lot. Diet supplements that can be added also, like DHEA, CoQ10. These have been shown to have positive effects on the IVF rate. Besides, multivitamins and folic acid and vitamin D, these needs to be taken, and success rate of IVF has been seen to be improved. Now I will discuss common myths related to IVF. One myth that is very common is age is just a number. No, it is not so. Although IVF can be done in any age group, but IVF success rate, as I've already discussed, depends upon age. So if it's in 20s or early 30s, the chances of success of IVF is more as compared to the later age group. Second common myth is that IVF is a painful procedure. Well, thanks to the technology, the injectables that are being used in IVF are now like pen manner, so it's not very painful. Besides the ovum pickup, in which retrieval of follicular fluid and egg, in that we use sedation or anesthesia. So IVF is not a very painful procedure. Third common myth is that IVF babies are not normal babies or they face problems in future. Well, IVF babies are just like any other normal baby. So it's a totally myth. Next myth is that women who have conceived through IVF, they need bed rest throughout their pregnancies. Well, it is not so. Although the age group in which IVF is done, a later age group, there are chances of having comorbid conditions and complication, but that does not require complete bed rest. So women who conceive through IVF pregnancies does not require absolute bed rest throughout pregnancies. Next, that IVF is a very expensive procedure. Well, it depends upon the cause of infertility and what is the underlying procedure that you will go through. That will determine the cost of IVF. So thinking right from the beginning that IVF is very expensive is wrong. Next myth is that IVF causes multiple babies. Well, it depends upon the number of embryo that have been implanted in the uterus. Now, the more advanced technologies, usually the most healthy embryo is selected and that is introduced. So that IVF procedure will definitely lead to multiple babies is wrong. Next, IVF in obese people is not possible. Well, this is wrong. The success rate decreases, but altogether it's not possible is wrong. Next myth is that IVF drugs causes cancer. Well, it is not so. This has been seen in various studies and it has been said that IVF drugs can be used and they do not cause cancers. Next myth is that IVF is the only option in the infertile couples. This is also wrong. Before going to IVF, the infertile couple is undergo thorough evaluation and depending upon the cause, the treatment is given. And if couple conceives through it, then it's well and good. And IVF is done only for the indications as I've discussed before. So it is not the only option for the infertile couples. Last myth is that IVF can be done only in infertile couple. Well, that is also a bit wrong because if any of the parent is having genetic disorder, then in that too also the healthy sperm or a healthy egg is selected and that only is implanted into the uterus. So parents with genetic disorders can also have babies through IVF. Besides, if the partners are of the same sex and they want to experience parenthood, so depending upon the donor egg and donor sperm, they can have babies.